was born in San Antonio, Texas. My great-great-great-grandfather came here in 1835 and settled a family, and we've been here ever since. I went to college at the University of Notre Dame in South Bend, Indiana. I became a doctor starting from a strong interest in science and did some internships, externships along the way, and really involved, I really liked the involvement with working with people on a daily basis, but the science also that goes behind it. And it's been very rewarding. I've been doing it for near 15 years now and seem to love it more every day. I went to medical school at the University of Texas in Houston at the Health Science Center there, followed by my residency at Washington University in St. Louis. Then I did further training in cornea, external disease, and refractive surgery with a fellowship also at Washington University in St. Louis. So I'm board certified in ophthalmology. That basically means there's some additional testing that this national body does every 10 years to make sure ophthalmologists are up on current medicine trends and surgery. I learned Spanish mostly from living in San Antonio, which I think practicing medicine in San Antonio, speaking Spanish is really a requisite. But I primarily learned Spanish working in Mexico in a dive shop. And so I first learned dive shop Spanish and then more medical Spanish following that. So we offer a lot of care to indigent in San Antonio, mostly through the Haven for Hope, but also do some work in Mexico as far as providing some surgery and support in mostly the South Texas area, though, where there is a lot of need. So we keep up with the incredible fast-paced of technology in medicine, mainly by attending national meetings, and we even participate in a lot of the teaching and education of other physicians, which is where you really learn a lot to stay at the leading edge of the technology. It's nice working in a group practice also, because we also learn from each other. We're all board certified here and also have all done cornea fellowships. So the nature of my practice is primarily a surgical consultative practice. We're mostly consulted by other physicians and optometrists and others in the medical field for surgical problems, a lot of cataract surgery, cornea transplants, LASIK. In addition, we do handle a lot of the toughest problems around as far as eye diseases that can also be managed medically. So in San Antonio, diabetes is really epidemic, and so every ophthalmologic practice and probably medicine practice really has to be adept at the specific problems with diabetics, which can be a lot of problems with the cornea, a lot of problems with the retina. Diabetics also get a lot of cataracts, and so we're very in tune with those treatments for diabetics, and they tend to need more care. Specific conditions related to diabetes that are often referred to us involve cornea problems where diabetics don't feel their cornea. They actually get a neuropathy in their corneas. And diabetics also have a higher rate of cataract, which we specialize in fixing. So we do a lot of advanced corneal transplants here. And one case I recall was a 5-year-old who came to us with a very rare congenital cornea abnormality. And there was a version of a cornea transplant that we've been developing and perfecting in adults for a while. But this specific child, this adult surgery would appear to be appropriate for this child. And I talked with a number of cornea experts around the country, and they agreed that this would be a good intervention for this child. And so we did, on this 5-year-old, the first what's called DSEC transplant for this congenital problem when he was 5 years old. And he turned 14, I think, this year, and it was a successful transplant, and since then he's acting like a normal kid, and and running, jumping, playing baseball, and his poor parents are preparing for him to drive because he has good enough vision to drive. One of the biggest moments of joy is bringing some of these new technologies to San Antonio and South Texas, and we've been the first to bring a lot of these technologies. And most recently, we've been doing a version of a cornea transplant called DMEC, where there are really only a handful of people in the country who are doing it now. And one of the moments of joy is amongst those first cases when we take the patch off the next day, and the recovery and the sight these people have even very early on is astounding to both the patient and the surgeon sometimes, because it just seems to work better than some of the older surgeries we've been doing. When our patients come to the office, we try to educate them from the very start through the end of the disease process. It starts at our front desk even, and trying to make patients aware of even their insurance issues and things that might affect them going through the medical system. By the time I'm involved with the patient, we're trying to educate them on both the disease state that they may have come to see us for, but also other issues that can be related to their health. Many times we can diagnose other types of things related to the health by looking into the eyes, and we'll also arrange that care and also educate their other care providers as to what's going on with their eyes. The communication is key, and we have a very sophisticated medical record system that we're able to share notes and data with other facilities and physicians very adeptly, and by the same token, we can take that information and incorporate it into their medical record. So we'll make sure we're treating the complete person, and to make sure they understand fully what's happening with their eyes, but also how it affects the rest of them too. So the resources we bring to patient care are really the most advanced in the country, in the world. We invest very heavily in the technology of ophthalmology, from the testing equipment that we have in the office to the most advanced lasers and surgical equipment in the operating room. And so it's from top to bottom in our practice, even in our medical record system, so that we can communicate and keep records effectively. And we train our staff in the same thing, so that they're adept on the latest technologies and personally oversee all of them. So we try to bring a much higher level of customer service than people are used to in medicine. Traditionally, there have been long wait times. We really educate and train our front staff to give excellent customer service like you would get at Disneyland and not at a doctor's office. And so we monitor that. I personally monitor schedules, and we try very hard to make sure we're not overbooked, but at the same time we're seeing patients in a prompt and appropriate manner. And it seems to work very well in our office. We tend to be a little more boutique, and we see many less patients than the average ophthalmologist, so we can spend more time with you. So after each surgical day, both myself and Dr. Lehmann will sit down with a list of whoever we've done surgery on that day, and we try to give a personal call that night just to make sure you're doing okay. And a lot of times that's just a level of comfort that we try to give to the patient, or if they have any questions that night, just getting through the first day before we typically see them the next day. So I'm trying to help people have a good life or good vision in spite of some of their illnesses, because there are some conditions that there aren't cures for yet, but we have a number of resources we use in order to maximize their vision, but also make sure they're doing the things they want to be doing or need to be doing, both for safety and quality of life. And so when you come to our office, we try to take that extra step to make sure that even if you do have a serious disease, we're trying to add to your quality of life regardless. A way we communicate with other referring specialists and physicians is sometimes just picking up the phone. We're known and have been for decades as a consultative service and consultative practice for the most difficult problems, many times anywhere in South Texas. And so other physicians and optometrists know if they have a problem, they can just pick up the phone and give us a call, and we get to the phone right away to try to get the prompt care that's needed. And by the same token, most other specialists know that if we're calling them about a problem that, it's pretty serious, and they will take our call right away to make sure that we're taking good care of you. In practicing the most advanced medicine and surgical care, it can be very expensive these days, and we're very mindful of the patient's cost involved in a number of ways. Number one, we with our billing department try to make sure that patients know exactly what's involved in their care. We have a sophisticated medical record system where we can look online to try to determine what medications are actually covered on your plan. And if those aren't, we'll take good care to make sure you can get whatever you need if a medicine is not covered on the plan or if it's very expensive. I feel my role as a physician is, number one, to take care of people and help with their quality of life. Many people come with very serious vision conditions, and especially the talk of sometimes surgery is very scary. And in addition to just fixing the problem, I want to hold their hand going through it and make sure the fears are not taking over as far as their anxiety, and make sure that the whole person is taken care of. We want to make sure you're seeing better, but we also want to make sure that your overall well-being has been taken care of at the same time. One of the biggest precepts of medicine is, above all, do no harm. And many times the most appropriate action, even with the advanced care we have these days, is do nothing at all, or not recommend a surgery, or talk with the patient to make sure that it's in line with how they want to live. Because not everybody necessarily will want the most advanced or the most prescient intervention that is needed or available. And many times time can heal things too. And so we take great care to make sure you know your options, and among those options, the risks and the benefits involved, and really, above all, do no harm. One unique thing about I think our practice is the physicians involved, and that we are really like-minded and very interested in truly taking care of people and making sure people have the most advanced care. We really work as a team. I have found really what I consider the best partner in the world as far as Dr. Lehmann, who we really can work interchangeably, and making sure if I'm not available that he'll take care of you, and vice versa. He's been a very good partner, and is who I would go to if I had an eye problem, and has become really my best friend. And so we take care of patients, but partly we do it by making sure that our practices run well, and it's easy to do when you have someone you trust as your partner. Dr. Lehmann came to me not too long ago and asked if I would do surgery on his mom, and of course I was very honored that he would want me to take care of his own mother, but at the same time, and making sure she had the best care in the world that we can provide, we really treat everybody in our practice like we're treating our own mother. And so she really wasn't any different than anybody who walked through the door who might not have known, but it was an honor to treat her, and I'm glad she's doing well.